Liposuction is one of the top cosmetic procedures in the country. The latest way to have it done requires no general anesthesia, no long-term recovery, and much less money.
Yeah, Fox 6 News reporter Christy Delano takes a look at how you can get lipo during lunch.
Angie Cody wanted to fit into her clothes a little better by taking a few inches off fast, but she didn't have time for conventional liposuction, which would have taken her out of work for several days.
I have 4 children and I cannot have downtime. No downtime.
But a procedure recommended by her doctor, Barry Ginsburg, took off the inches and allowed her to get back to her life right off the treatment table.
You can still go to work, your normal routine, and that's what appealed to me.
It's called tumescent lipo, or liposuction, under local anesthesia.
Some of the complications associated with liposuction are really complications of general anesthesia and have nothing to do with the area of fat removed.
Tumescent lipo is much like its more popular counterpart. Tiny tubes are used to distribute a local anesthesia called lidocaine to numb the area. The difference, the patient is awake the entire time.
You feel a little prick. You do. But then this whole area is numbed with lidocaine.
Then the doctors move these cannulas back and forth under the skin to suction the fat out.
You may feel movement and pressure, but you don't feel sharp pain or discomfort.
It doesn't hurt. You can actually bring a DVD or something and sit there and watch the DVD while he's doing it.
Cody says the results are amazing. The amount of time the procedure takes depends on the area. A chin, little more than an hour, while an abdomen or back area could take 2 or 3. But it's the recovery time that draws most people to tumescent lipo.
Literally, you can get up off the table, drive home. You can get up off the table and walk 4 miles if you wanted to.
While with general anesthesia, lipo recovery could take several days. Cody has had her chin, back, and stomach done using tumescent lipo.
One procedure was done on an afternoon, and I was back at work at 6 the next morning.
Most people can return to work and exercise the next day. And that's when we do a fairly large procedure, if we do an entire abdomen. If we're doing the outer thighs or the inner thighs or a smaller area, you can exercise the same day.
Cody says it's just what she needed. She left for lunch one day and came back looking like a new person.
I went from a 2X to an extra large. Wow. And they've been a large now, of course. But you look so much better in your clothes. You feel better about yourself.
In Birmingham, Christy Delamo, Fox 6 News.
Tumescent lipo can cost anywhere between $1,500 and $5,000, and depending on the area, it could take more than one visit.